Hello and welcome to this week's video. I didn't really have a plan for this week's video, but events of this week have made me realise that it would be rather good if I focused on being able to use Qigong effectively if for some reason you are disabled or if you have an issue with chronic pain. Some of you will know, well, most of you who watch these videos will know I've been having a problem with pain in my hip that I've actually been using Qigong to try and help with. Right, I have a very simple mantra that I use in classes where I'm working with a group of people, most of whom are disabled and wheelchair bound, which is, if you can breathe, you can do it. And I say this because this is called Qigong, translates as energy work. But there is a very strong link between your breath and your energy. It's your breath that helps direct the energy. With some moves that I do, I suggest that you imagine breathing out along your arm or something like that. And that's because imagining that you're sending your breath to a particular part of your body is one way of directing the energy to where it should be going. So, if you can breathe, you really can do Qigong because you can still work your energy. You may not be able to make all the showy moves with the arms that I demonstrate in the moves, but it doesn't mean that you can't do and get significant benefit from a regular practice of some of these sorts of moves. So, how can you do this? Right, well, I've got a whole class of people who can't move their arms or legs, or in some cases their heads. And for me, although the ideal is when you're doing Qigong, you're standing up, you've got this really good posture, you've got your back straight, you've got your neck straight with your chin tucked in so the top of your head is pointing up at the ceiling. If you can't do that, then you just do as best you can and what works for you without causing yourself pain. So if you've got significant pain in your legs or hips or knees, which means that standing up for any length of time is a problem, it's quite easy. You sit down. But when you're sitting, and I've covered this before, but it's worth covering again, you still have to make sure, as best you can, that you are sitting in the best position, back straight, neck straight. But for some people that's impossible. They've got bad backs, they actually may have physically deformed backs. Years of disability may have meant that their muscles have wasted, or difficulty walking may mean that one leg is actually longer than the other because one leg has shrunk because of pain or whatever. And so if your body is providing you with, unfortunately, with physical issues that mean that you cannot stand up straight, still get yourself as close as you can to that ideal without causing yourself pain or discomfort. It's not about doing it perfectly. I always say this, it's about doing it perfectly for you. And when you are aware of what your body needs, you are being mindful. And although I divide these videos into kind of two distinct sections, I've got the Qigong part and I've got the mindfulness meditation part. Actually, the whole thing is about mindfulness, because during the Qigong I'm asking you to be mindful of your breath. And I'm also asking you to be mindful of the signals that your body is sending you, so that you don't do anything that causes pain or discomfort. So it's all about being mindful. If you are doing your Qigong to the highest possible standard for you, you're actually being mindful of what your body needs. And by trying to do the moves to the best of your ability, you are actually helping healing to happen. Take the issue I've got with my hip at the moment. I've got osteoarthritis. I've been diagnosed with osteoarthritis in my hip. Now I know that isn't going to get any better. But what's causing the pain is the head of the femur and the ball on the hip, the ball joint on the hip, are kind of grating against each other, and that's causing wear and tear, and that's causing a bit of pain and inflammation. Now, that's happened for a number of reasons. One is, yes, I could stand with losing a few pounds. My BMI is too high, and the amount of weight on your joints is an important factor. But also, as a society, we've forgotten how to stand, and so we tend to stand without really using our core muscles. We no longer need to use our core muscles. We've got all these machines that do work for us, and we've all fallen out of love with exercise. But when I'm standing straight and I'm in a good position and I've got these core muscles engaged, it actually opens out anything to rub and cause pain. And that's why practicing Tai Chi, practicing Qigong, has become quite an important part of me trying to manage this new situation that I'm in, because I can't get rid of it, but I've just got to live with it. But I can do what I can to stop it getting worse. So, standing or sitting in the best possible posture is actually a massive help. And even if that's all that you can do, and just take a few deep breaths, or maybe do move one, just raising and lowering of the arms, as long as you're doing it mindfully, do you know what? You're doing some Qigong, and I'll give you a round of applause for doing that. The moves always need to be moderated so that what you're doing doesn't cause pain or discomfort. I cannot say that too often. My biggest fault is I often realise that as I raise my arms, I'm hunching my shoulders and I cause an ache in my shoulders. And if you ever hear me say during a session, make sure your shoulders are nice and relaxed, 9 times out of 10 that will be because I've realised my shoulders aren't, and I've actively tried to relax them. I don't always get it right, and I'm not ashamed to admit that. The other way that these videos can be helpful with pain and discomfort is with the mindfulness. A mindful meditation can be a really, really good way of actually helping you manage the pain, because the natural thing when you have pain is to try to distract yourself, to block it out. Maybe to try and pretend it's not there, although if the pain's really bad, I know that you can't. However, a lot of the pain that we get when we have a chronic condition doesn't come from what's happening now. It's because when you've got chronic pain, you've got in this mind, you're running through this list of things that could trigger it. And when you know you're going to do something that might trigger it, you naturally tense against it. So what causes the pain isn't what's happening now, it's because you're thinking ahead to what might happen in the next moment. You tense the muscles, and that actually makes the pain worse, because when you've got joint pain and you use mindfulness to really explore the pain, you can actually see, well, okay, I know the problem's in my hip or in my ankle, but hang on a minute, that pain that I'm experiencing now is actually not in the joint, it's in the muscle. And it seems to kind of spread and become all pervasive. And trust me, I know what that's like. I've had sciatica. And that's happening because you are allowing your muscles to tense. And so they, in turn, become used to being tensed. And when you try to relax them and stand correctly, they object. And very often when people who've had chronic problems are being asked to stand or sit, if they can't stand, to sit in a better position, they say, well, that hurts, I can't do it. Thing is, it's the muscles. You can't do an awful lot about the joint pain, but you can do something about the muscle pain by learning to relax the muscles. And this was where the concept I covered last week of the empty arms is so helpful. And a mindfulness meditation, and the mindfulness meditation that I will be doing today is very much going to be focused on how to deal with chronic pain. And it's not by distracting yourself, it's actually by confronting it. Because very often when you confront it, you find it's not as bad as you thought it was. For a lot of people, when they have an issue of pain, they know that there is a solution for them. But I have a group of people for whom their pain is never really going to go away because it's part of their overall disability. Having to live life in a wheelchair is something that comes with, many problems, but pain is one of them, and that's something that's quite often not noticed. Now, I know that there is not a lot that I can do to help that pain go away, but what the mindfulness can do is change their reactions to that pain so that they can find different ways of dealing with it. Anyway, I've wrapped it on for long enough. I'm just going to lead you through a few Qigong moves and then we will do the mindfulness meditation. So, I'm going to stand up. Yes, I can stand. So, get yourself standing or sitting in the best position for yourself. Get your back as straight as you can, get your neck as straight as you can. Top of your head pointing at the ceiling. Arms gently hanging by your sides. Core muscles engaged, just a gentle pelvic tilt forward. And as you do that, maybe think about literally opening up your hip muscles, your hip joints. And also, as you breathe with your abdominal muscles engaged, maybe you can get this idea of these muscles a little bit like a concertina or an accordion, expanding and contracting, expanding and contracting. So take a moment to get yourself into the best position that you can, and then imagine yourself in that lift. That beautiful lift with the glass floors and wall overlooking the most beautiful countryside. See yourself in that lift. As you look out, you feel relaxed and calm. And then, as you breathe with every out breath, just allow that lift to gently float down, one floor at a time, until you reach the ground. And get your hands hanging loosely by your side. Just breathe. Just feel how your whole body slightly moves with every breath. If you're standing, make sure that your legs, your knees are very slightly relaxed. And then when you're ready, with the next in-breath, just allow your arms to float out in front of you And as you breathe out, they just naturally sink down. Don't force anything, just let everything flow gently and naturally. Only move your arms as far as you can manage in one breath. Don't do anything that causes your shoulders to ache. And remember to keep your arms long, loose, light and empty. Keep those muscles relaxed in your arms and relaxed in your shoulders. And then we'll do this move twice more. Then we'll go on to the next move, opening the chest, letting your arms rise and spread apart, and then as you breathe out, they float back in. As you breathe in, really feel the expansion of your chest and your lungs. And let that expansion be reflected in the movement of your arms. We'll do this move twice more. And then with the next in-breath, get ready to paint rainbows. As you breathe out, sink slightly on your left knee and let your right arm uncurl. As you breathe in, everything comes back to the centre. Then do the same on the other side. Remembering to keep your back straight. Remembering to keep your shoulders relaxed. I'll do this move twice more, once more on each side. And then this time as you breathe out, let your hands float out and down. Imagine that you're pushing away the clouds. Letting your arms rise on the in-breath and letting them float out and down on the out-breath. Imagine yourself just pushing those clouds away from you. We'll do this move one more time. And this time as you breathe out, bring your hands into position ready to balance your chi. So as you breathe in, imagine you're smoothing around a small ball, and as you breathe out, try to push it underwater. Last time for this move. Breathe out, and if you can, let your hands come to rest in front of your belly, or just let them float down into your lap or by your side or whatever is comfortable for you. And just for a moment, sit or stand, very still and calm, and just get that feeling of everything just settling back to where it should be. Just for a few breaths. And then, when you're ready, get yourself settled, seated lying or even standing if that's what you want to do. Ready for our meditation. So, get yourself seated, lying down and comfortable. And just a reminder that mindfulness doesn't mean you need to close your eyes. But if you find it easier to direct your focus where I'm suggesting, then by all means close your eyes. But it's not necessary. So, first of all, I want you to become aware of everything going on in your surroundings. Be aware of what's touching you, where you're sitting or lying, what can you feel. Be aware of what you can hear. Try not to classify or identify anything. Just be aware of your surroundings. And just realise that for the next few minutes, this is your time. And just let your surroundings fade as you send your awareness into your breath. And just focus your awareness on every in-breath and every out-breath. Don't want you to worry what you notice, just notice what it is that you notice as you naturally breathe. You'll all notice different things, but that's okay because you're all individuals. One thing you may very well notice is that your mind wanders away from focusing on the breath because it's a slightly unnatural thing to do, and there's part of your mind that really won't want to do it. So, when you notice your mind's wandered away, I want you to congratulate yourself because you've noticed what your mind is doing. That means you're being mindful. But then gently lead your mind back to focusing once more on your breath. Just every in-breath and every out-breath. Now I want you to use your breath to explore your body. As you breathe in, can you imagine your breath circulating round the whole of your body? Allow your breath to explore every part of your body. Most times people start with their toes, but you can start wherever you want. Just use your breath to explore every part of your body, one piece at a time. And just be aware of what sensations you have in the particular part of your body you're exploring. Now, as you're sitting or lying or standing, you may well find that there's part of your body that is sending you signals of pain or discomfort or even distress. And if that's what's happening to you, I want you to use your breath to explore that part of your body that's sending you signals. And as you explore that part of your body, you may notice that as you become aware of that area of your body and that the muscles in that area just relax quite naturally. Because when you think about a muscle, it's actually natural for it to relax. And I want you to use your breath to explore all the sensations that you have in this part of your body. Is the pain constant? Is there one position where the pain is easier? You may very well find that the pain rises and falls in a way that you hadn't noticed before. Really put your whole awareness into that part of your body. Actively relax it and see what that does for the sensations of pain. Use your breath to explore the discomfort. Because what seemed like one block of sensation, you may very well discover actually isn't as constant as you thought. It rises and falls. Now, if you have more or less constant pain, even if it's rising and falling, I want you to think about how you would respond to someone you loved who was in trouble. If you're like most people, you would want to go up to them and give them a hug. Can you try to respond to that painful part of your body in the same way? Respond to it with the same love and compassion that you would show to a friend who was in trouble. With your next in-breath, can you try to imagine that you breathe in feelings of love and compassion? With every breath, fill yourself up with love and compassion, and then with your next in-breath, breathe down into that place that's sending you the signals of pain, and imagine that you're hugging that part of you with your breath. That breath that's filled with love and compassion. Maybe imagine the breath is massaging that area, just as a mother will rub her child's hand or knee if they've fallen over and hurt themselves to make the pain go away. Can you try to imagine doing the same thing with your breath? Just surround that part of you with a breath filled with love and compassion. Because turning away from something that causes us a problem doesn't always help. It can make us tense and anxious. And being tense and anxious really doesn't help anything. So bring your awareness now back to just the simple act of breathing in and breathing out. Keep your awareness on your breath. And if you can, try to become aware of that moment of stillness that happens in between each breath. If you can't become aware of it, just imagine that you do. Just imagine that point of stillness in between each breath. And imagine that stillness slowly filling the whole of your body as you breathe quite naturally and calmly. Then let your awareness start to move outwards, moving away from your breath to become aware of where your body is, what's touching your body. Maybe become aware of the
where your body and the surrounding area meet in terms of your skin and your clothes. Then let your awareness spread outward so that you become aware of the room. And once more become aware of sounds both inside and outside the room. And then when you're ready, bring yourself back to normal awareness. But as you do, keep in the front of your mind that you can anchor yourself to this feeling anytime you need to, simply by putting your awareness into your breath. And then do make sure that you are fully back and fully awake and alert before you go on to do anything else in your day. Thank you for watching. Thank you to those who will be watching it later from the archives or on YouTube or even on my Patreon page. If you've enjoyed it, found this useful, I'm ever so glad. If you know somebody else you think might find it useful, do please feel free to pass the video on to them and tell them about what I do. And if you have any ideas for anything that you'd like me to cover in future videos, please let me know, PM me. And if you go to YouTube, you can find all the videos that I've done, so you can explore different aspects of Qigong and those videos. And I hope that this will encourage you to do something Qigong related as part of your daily self-care ritual. Thank you for watching. I hope you have a good day, and I look forward to being with you next week.